Hi.
My name is Rebecca, and I am going to be your student nurse today.
Okay.
So I am going to be doing what we call a head-to-toe exam. So I'm basically just going to kind of evaluate all your systems from head to toe and make sure that everything seems to be working well.
Okay.
Do you have any questions at all?
Nope.
Okay. Can you tell me what your name is, please?
Amanda Schumacher,
And your date of birth.
9/13/1997.
Good. Do you know where you are today?
I am at LTC.
Okay. And what day of the week is it?
Tuesday.
And who's the president?
Well, most would say Joe Biden. Some wouldn't, but.
Good answer. Well, at least you gave me the right answer. Okay, so the first thing that I'm going to do is I'm going to get a set of vital signs on you.
Okay.
Right, so I'm going to go ahead and get my stuff already here to do that. So having a good day today?
I mean, it's a day.
All things considered.
Yes, all things considered.
But you don't want to be lying in a bed in LTC right now.
Better than lying in a hospital bed, I suppose.
But it feels comfortable. So I'm gonna take a look at your hair.
Let us get tight, okay?
Okay.
Okay, so I'm looking at and I don't see any anything that feels good. It doesn't feel too dry. First thing, is there any
Okay, perfect. Go ahead and lift this up later. I'm going to give your arm a rest.
Okay.
So while we do that, I'm just going to take a couple of the vital signs here.
Sounds good.
First thing I'm going to do here is check your temperature.
I know.
Alright, so this is just going to go into your ear. You can turn your temperature for me.
But that's normal. So what I'm gonna do is I'm gonna first shine a light.
Oh, my temperature is 9900.
Oh, really?
You're good on there?
It's been hot all day.
Next thing I'm going to do is I'm going to check your O2 saturation. Use that hand. Perfect. Alright, you can go ahead and rest your hand down for me, right?
And I'm gonna have to take a look at your conjunctiva.
Alright, I'm also going to check your capillary reflexes here while I'm here. Make sure that all looks good.
So when your conjunctiva is
That looks perfect.
on your eyes, there's
Everything is refilling like it should be and means you got good circulation going to your hands.
Good.
O2 saturation very good at 98 and your pulse is at 70.
perfect. It is pink, moist.
Oh, I just took this up and we need to reuse it.
Any pain at all right there? And while I'm here, I know what I'm
Just
ears yet,
check
I just
your
want to
pulse.
look at your ears, and they are at the same line as your eyes, so that's good. If they weren't, that might indicate some type of congenital defect. So you don't have that, which is good because we all hope for that. So now I'm gonna go ahead and look in your mouth if you don't mind. Are you chewing gum? Sure.
The garbage right here.
Perfect. So, what I'm looking for in your mouth is I just want to check for any skin lesions or any open areas. Is there anything in your mouth bothering you? And your teeth are your own. You don't have any dentures, any partials, or anything?
No, thank you.
All right. So if I just say, can you open your mouth, stick your tongue out, and say ah? Good. I can see your glands. That's good. Everything is moist.
Perfect. So I was just checking your respirations.
Perfect.
You're at about 20.
Okay.
So that's very good. It's all within normal limits.
Nice. Thank you.
I'm going to check both of your pulses just to make sure that they're equal on both sides.
Okay. I am going to
That
take
feels
your right
great. Doesn't
vitals
feel
and
anything
your
abnormal.
pulse, your temperature, your
Perfect.
blood pressure. So
I'm also going to just check
and
your skin
pulse
here.
ox. And your pulse ox is just goes on your
So it all looks very normal. It is not too hot, too cold. It's nice and dry. So that's good. I don't see any sort of swelling. Okay, let's go ahead and put this back on, and then we're going to actually take your blood pressure.
No, it does not matter.
Up and back.
So that's a full minute of connecting. So that's normal.
97.7 is a good temperature.
But you're done there, so your respirations are good. Pulse, oxygen. Now I'm gonna get your blood pressure, so I'll have you sit up, please.
So now I'm gonna take your blood pressure, and while I'm doing that, I'm just gonna go ahead and let this hang out in your finger.
Is it okay if I do it from this one? Okay. And you had no surgery on this arm, correct? Alright,
There's
good.
no polish on it. Is it against particularly cold? No, not well. Do you have a preference as to which arm I take your blood pressure?
It doesn't matter.
I'm just
Very possible.
Up all the way, but at least you can get it there.
Actually, what I actually might do is I didn't pull it all the way down.
Oh, so it's nice and flat.
Yeah, so there's less room.
There you go.
Let me get dry. Nope, you're good.
118 over 68.
Nice.
Very nice. Those are some good numbers.
Good. Good to hear.
Okay, while I have you here, I am going to go ahead and I'm going to listen to your heart if that's okay.
No.
Well, my instructor might have something to say
Oh,
about that.
crap.
Don't make me call her.
Oh, well, that's good.
Okay. I stopped hearing that at 80, so I gotta pump 30.
Sure. Oh, no.
Okay, I got
Not that I don't trust it, but now I don't trust it.
I said 70. Is that your?
It's the cord is really stiff,
Oh, I see that.
so I think it's just a,
Do you
yeah.
want me to hold that?
Actually, see, now I got it. Okay.
Good. You're 64.
Nice.
So I'm just going to check your,
Next thing would be.
yeah, these things in your neck. So I'm going to check for bruise, your arteries. For bruise, so I'm just going to take a quick listen to make sure that we don't hear anything, okay?
Okay.
Okay, I'm gonna do your eyes, okay, I'm gonna see how you do with
110
the
over
tab.
78.
Perfect, that sounds great.
And your
Next, I would like to, when was the last time you used the bathroom?
So,
A couple hours ago, but I'm
Okay.
okay.
Are you sure? Yep.
Yeah.
Okay. Do you have any issues at all when
Now
you
we're
with
gonna
urination, regular urination, any odor,
Nope.
smell?
your heart.
Odor and smell is the same thing. Any pain, urgency with urinating?
Nope.
Okay, what about your bowel movements? Let me do those bowel movements.
This morning.
Okay, and is it pretty normal?
Yes.
Okay, and do you go have a bowel movement on a regular basis?
Yes.
Any issues with that at all?
I do have IBS.
Okay, yeah, that's always fun, I'm sure.
Yeah,
I feel
it
that.
is.
Okay, so what I'm gonna do is I'm just going to check your abdomen, and
Okay.
then I'm gonna listen.
Okay.
So, just viewing everything, you got a little bit of a rash here, looks like.
Oh yeah. I forgot about
No distension, everything looks good. I don't see any sort of bruising. Everything's symmetrical. So I am gonna go ahead and I'm gonna just take a listen, okay?
that. Okay.
Okay, and I'm seeing your pupils constrict, they dilate and go
74. So that's really, really good. That's right in normal. So now what I'm going to do is I'm going to compare both and just make sure that they're nice and equal.
Read that first one.
Perfect.
Alright, so I
So,
checked your,
now what I'm going to do is I'm going to listen to your heart, okay?
so send your way, see your stats. This is
Not
right
that I
there.
don't trust my stethoscope, but I don't trust my stethoscope.
And then, let's see. And when was your last eye assessment, would you say? A year ago. Oh, okay, 6 months ago, okay, alright. Because I recommend getting it done once a year. And what I'm gonna look at is your conjunctiva, okay, and I'm gonna look up, I'm gonna pull down a little bit. Very good, okay, they're not red, irritated, or pulsing or draining. And then I'm also gonna check your, lacrimal duct. And that's good, okay.
Okay, so your bowel sounds were very regular
Okay.
throughout,
Eyelashes are
so
nice and
no
low,
concerns there at all.
and your eyes are
The next thing I'm going to do is I'm just going to palpate, okay? Let me
Okay.
know if anything hurts at all.
Okay.
Your eyes are nice and really white and dark. So there's that difference.
Any pain at all with that?
Nope.
Any pain there?
Nope.
Okay, good. Alright, so yes, I need to listen again for your bruise. I'm not going to go down the femoral area, but I am going to check the
I'm
renal.
going to start at your back, okay? So, first I'm going to listen. I'm going to put my stethoscope here if you just want to take a nice deep breath in.
It's not too bad. That's same with me. So at least once a year.
Okay, you want to take a nice
Gotta see a dentist. All right. So I'm looking at your
Excellent.
lips. They look moist,
Deep breath,
not
please.
dry or cracked. All right, and say ah.
Okay.
All right, and then let the tongue up. All right, and again, just
Excellent.
look to the side, left, to the
Nice
right.
deep
Alright,
breath in.
that all sounds
There we go.
great.
And
Good.
Okay,
very good.
so let's
there's
see.
no lesions or cuts or blisters in the mouth.
So now
The next
let's
thing
make
I want to do is I am just going to just check your legs real
And
quick
I'm
for
gonna
any sort of edema.
Okay.
I don't see any sort of
Listen to your lungs.
edema to your legs at all. Coloration all looks good.
It looks good.
Okay, go ahead and
There's
take
not
a deep
like
breath.
any, like a plug,
Excellent.
pocket in your skin.
breath.
And check your capillary reflexes.
And you have your own teeth,
Color
right?
looks
And
good.
then here, can you take a deep
You're
breath?
young enough, you should have your own teeth.
Okay.
Okay, that's great as well. I just want to feel.
No, okay, that's good. All
Perfect.
right.
Your breath
And,
sounds are good.
Okay, those look good. Okay, so the next thing I'm going to have you do is I am
On
going
your
to
chest for a moment, if that's okay.
I'm gonna check that, okay?
And I'm gonna have you go ahead and sit up, and then you can sit up on the edge of the bed for me. Alright, so I'm just gonna kind of start again from head to toe, and I'm gonna just
There we go. Look down.
assess a few different things.
Okay.
First, I'm gonna feel your head and just make sure that
Just my hand.
everything feels okay. I don't feel any lumps or bumps.
And
I don't really see any lace or anything like that.
Okay. That's
Any discomfort with your ears at all? Any pain or drainage or anything like that?
Nope.
And can you hear me okay? Are you having any issues hearing me?
Nope.
Okay. So the next thing I'm gonna do is
Which is good.
Okay.
just gonna feel for your glands here.
Definitely within the normal range.
Alright.
So now,
Alright, what
if you don't mind laying
feels
down.
And do you want shirt
Okay, so everything there feels good. So next I'm gonna just check your range of motion. If you can put your chin to your go and back up. Perfect. Now I'm just gonna have you turn. Did that hurt at all?
Nope.
And then ear to shoulder.
Yeah, alright, okay.
Does any of that hurt at all?
Nope.
Oh, good. All right. Shrug your shoulders for me. Any pain with any of that?
Nope.
Nope. Okay,
And,
good.
also.
And do you have all your own teeth?
Yes.
Definitely.
good. I'm just gonna take a quick peek inside of your mouth, if that's okay.
Okay.
Excellent. Are you comfortable? Alright. So while I'm looking at your neck, I'm just gonna listen for berries. Which is a sound that you
Oops.
don't want to hear. So
I'm gonna have you, deep breathe, okay? Inhale.
Alright.
if you could just hold your
Just gonna take a
breath for
peek
couple
inside of your mouth to
seconds.
make sure that we don't have any lesions and that there isn't any sort of redness or sores that we need to worry about.
Okay.
No bruise. So then
Open up your mouth to get a chance to see.
your
Good,
face,
everything looks pink.
and assess the temperature.
Good, no lesions or anything like that that I
Warm,
can see.
skin feels nice and moist.
Alright, so the next thing I'm gonna do is I am just gonna check your eyes. Okay, I want you to look right at my nose for me, okay? And I'm just gonna see how your eyes, how your pupils react to my light.
No edema. Excellent.
That's good.
And then can I just
Constricting just the way we wanted to.
Nice coloring, nice and warm.
Okay, and I'm gonna have you just look at the tip of my pen. Now I want you to look at the wall.
And then it should go back right
With my
away
pen.
and through. Excellent.
Perfect, that looks great. Alright,
And
and then I am just going to look at the inside of your
I'm gonna
eyes.
lay you down and I'm gonna listen to your bowels.
Very nice, everything looks very pink. Any pain at all with any of this?
Nope.
Oh, great. Fantastic.
Which is weird.
Alright, the next thing I am going to do is I am going to listen to your lung sounds.
Okay.
Wait, look.
Can you turn me and face the wall just a little bit?
This way or this
That way.
Oh, dog.
Alright.
Alright,
So over here
no
out of the way
no
there.
problem. Abdomen.
All right.
You went to the bathroom. Okay, and you don't have any
Alright, go ahead and
pain
take
in
your breath for me.
abdomen? Okay, so like if I just push, nothing hurts? Good, okay, so now I'm gonna listen.
I listen to your bronchial area here, and then bronchial, and then vascular. Very on the lower part, which is the posterior, and then the anterior extreme. I listen to
Um,
bronchial, vestibular.
I would say I heard about 4, it was kind of continuous, so that's good.
And then, oh, I gotta listen to the.
Alright, that sounds awesome. So I was hearing some nice bronchial vestibular breath sounds up here and vesicular down here in this area, which is all extremely normal. So I'm going to have you turn and I'm going to listen from the front. This time you can just breathe normally, okay?
Are there any crackles, the wheezing, so that was very good. Your heart sounds very good and strong. So next thing I'm gonna do is, I'm going to have you lay down so I can listen to your lower rib.
Strong heartbeat.
Oh, God.
I use the back of this.
Okay, and if you can raise your right arm up for me, I'm just going to listen to breath sounds from the side.
Okay.
Alright, that
So
sounds
I heard 4 in this, 3
fantastic.
and 5 in that one.
Okay.
So,
Alright, a few more range of motion, not range of motion, but a few more strength tests.
Okay.
If you can push up, or don't let me push you down. Don't let me push.
So when I could do that.
Don't let me push.
But I didn't hear any bruise, which would be.
Don't let me push down.
If I were to hear
And don't let me push you
let
up.
the doctor know immediately.
Alright, so that is all very good as
I'm
well.
looking at your abdomen and
And
watching
I
your
did forget to check first. I would like to check for dehydration.
Okay.
So I am just going to do a little bit of pinching here in the arm to make sure that we don't have any which we do not, so that all looks very good as well. So your whole chest area, everything looks good. It's very symmetrical, no barrel chestedness. So yeah, so all of that looks really well. let me think. What is
Okay, so we're
next?
gonna check your range of
Head,
motion
shoulders,
for
knees, and
one.
toes. Alright, I am going to have you lay back down.
Okay.
And we are going to do some range of motion.
Okay.
To make sure that nothing is
And
hurting.
if you could just look side to side.
Don't hear anything.
And then your shoulders are
Alright.
excellent. Now I'm
So first thing I'm going to do is I am going to do some range of motion in
forward,
your arms.
and then
Okay?
back, excellent. Now,
Any pain with that at all?
Nope.
very good, good range of motion. One other thing,
Okay. We're going to come out.
excellent. I give you a 5, you're very strong. Oh. Use my fingers, excellent.
Sorry.
So I will come your ears. And
Alright, now we're just going to do just your wrist.
Okay.
that was a little cerumen, but not too much. Let me look at your other ear. Looks good. Any tenderness at all?
Fingers.
Excellent. Excellent. And if I could just have you look at my light. I'm gonna test the muscles of your eyes, so if you could just look, if you could just have your eyes look up but not move your head.
Okay, so that all looks really good. Was there any pain with any of that?
No.
Okay, so the next thing that I am going to do is I'm going to do your leg.
Okay.
Excellent.
So we're going to bend and go.
Now, I think I'm officially done. Do you have any questions at all? Alright, no more concerns or anything?
Nope. And we're going to come out this way.
Alright, perfect. That should do it then. Thank you so much.
You're welcome.
And rotate.
I know.
We're going to do your foot. And your toes.
So here's the video.
Lovely. And again, no edema, everything. I don't see any swelling or bruising anywhere. I want to say I think that's it. I hope I didn't forget anything. But who knows? I guess we'll find out. And I didn't want to look at my sheet to cheat. So, no. So I appreciate everything today, and I will document all my findings. Do you have any questions at all?
I do not.
Okay, so I'm going to give you your call light, and please let us know if there's anything that you need.
All right.
All right, thank you very much.
Thank you.
I appreciate it.
No problem.
Oh, I gotta shut my thing off.